Today, throughout this presentation, we're just going to talk about the general principles of delegation and assignment making. We're going to talk about what the nurse's role is in delegation and also discuss a couple of resources that we should be thinking about anytime that we are faced with delegation questions. So the reason we think it is so important to talk to you guys about delegation, assignment making, and prioritization is because when we look at the NCLEX test plan, we can see that management of care is 18% of the exam. So it is the largest percent of the exam, even more so than safety and infection control. So that means when you go to sit to take the NCLEX, it's a guarantee that you will see those types of items. You will see delegation, you will see prioritization. And I want to remind everybody that when we're talking about delegation, that's not simply asking somebody to just perform a task for you. It's a very complex nursing skill that you really need to know, not only for the NCLEX, but for practice. Because as you all know, when you go to the hospital and you see those nurses, it is one of the most commonly used nursing skills. But if we do it incorrectly, it can get us into a lot of trouble. So we want to make sure that we really know what we're doing so that we can delegate safely. I want to go ahead and let y'all know 2 helpful tips that's going to guide you throughout this presentation and whenever you're practicing delegation. The first one is we don't ever want to delegate tape tasks. Those are things that the registered nurse is responsible for. It includes patient teaching, assessment of your patient, developing the care plan, and evaluating the patient's care and their response to interventions. So those things we do not want to delegate. And also, I know you already know this, but I want to remind you guys, we never want to delegate tasks on unstable clients. So we want to make sure we are only delegating for stable clients. So there are a couple of resources that can help guide us whenever we're navigating delegation questions that we really want to be familiar with. The first one is the provider's scopes of practice, and the second one is the 5 rights of delegation. So let's look at those really briefly before we jump into some practice questions, which I know is what you guys came for. So the scopes of practice is just understanding what is it that our peers that are working on the unit with us can do. What is in their legal scope of practice that's safe for them to perform? So let's start with the UAP. The UAP has the smallest scope of practice, and I will tell you, most NCLEX questions on delegation are delegating to that UAP. So the UAP can only ever perform care on stable clients. They should never complete any type of tape tasks. They should not perform any part of that nursing assessment. That is outside their scope of practice. And they are typically responsible for performing routine and non-invasive tasks. So when I say that, I'm talking about vital signs, hygiene like oral care, pericare. Once again, it's only for clients that are stable. And then there is the LPN or the LVN. That is the same role, but it's just different names depending on where you live. So LPNs, you won't see these questions as often as the UAP, but they can be a little trickier because their scope is a little larger than the UAP. However, the LVN can only care for stable clients, just like that UAP. LPNs can perform parts of the nursing process, but it's only after the RN performs them first. So they are able to help with reinforcing teaching after the RN has already provided it, and they're able to help monitor assessment findings after the RN has performed the assessment. So I know it can get a little tricky, but remember, when it comes to the nursing process, the registered nurse always has to perform that task first. And they can also administer medications, but it really depends on where you live, so you don't see those questions as often, but they are able to typically administer oral medications, that kind of thing. And then there is the RN, and we have the largest scope of practice. We are able to care for stable or unstable clients, and we are responsible for all steps of the nursing process. So the assessment, the planning, the evaluation, and once again, we should always be performing it the first time. And we also can do any tasks that are invasive and non-routine as well as routine tasks. And an example of invasive tasks that the RN might perform include hemodynamic monitoring, and then also titrating like cardiac drips in the critical care unit. So hopefully that gives you just a brief summary of the general scopes of practice. Now, don't get too confused. I know I was an LVN, and I know many of y'all go to the clinical setting and see nurses, and you don't always see people following their scope of practice. But remember, this is what is accurate and appropriate when you sit down to take NCLEX, not what you necessarily see in the hospital or the clinical setting, unfortunately. I want to show you all one more thing, the 5 rights of delegation. So basically, this is just 5 questions that we should ask ourselves before we delegate a task. So the first one is the delegatee or the person that I'm asking to perform the task competent? Do we think that they have the appropriate knowledge and training to safely perform the task? And then we have to ask, is that task routine and within their scope of practice that we just discussed? And then we always need to make sure that that client is stable. Now, one thing I want to remind everybody about is we typically use delegation the most when we're very busy. However, that RN is still responsible for supervising. So the RN can't delegate a task and then leave the unit. That's not safe. The RN needs to be readily available to assist and to follow up on that task. And we also need to make sure that the delegatee has very clear instructions on when to perform the task, how to perform the task, and any information that they need to report back to you. And then lastly, as the registered nurse, we should always be going back after a task is performed to make sure the patient tolerated it well and that everything went as planned. So once again, these 5 questions kind of can give you a framework. So when you're thinking about if a task is appropriate, these are the kind of things you need to be thinking about to help guide you.